Thank you. Good morning, everyone, and I'm just so thrilled to be here. And I'm first now, so I have you all very fresh, and I look forward to hearing some of your questions if you have any. So I'm a health services researcher, and I'm here locally at UNC at the SHEPS Center for Health Services Research. And a while ago, my area of research was postpartum weight loss and actually pregnancy weight gain and postpartum weight loss and physical activity and diet. So I'm really looking forward to talking with you about that today. I'm going to start with something that's probably not news to you, but it's still very depressing and sobering. But nearly 2/3 of women in the United States today are either overweight or obese. So 2 out of every 3 women is overweight or obese. That's an awful lot of women. And we know that weight gain during pregnancy and the inability to lose that weight postpartum, they're believed to be significant contributors to overweight and obesity among reproductive age women. And we've even seen that there's prediction of how much weight you retain postpartum to obesity 15 years later. So I want to talk a little bit first about what is postpartum weight loss. It's exactly what it sounds like. It's losing your pregnancy weight after baby comes. And typically most of the weight comes off in the first 3 months after pregnancy. And then there's a slow and steady decline through 6 months. And so I say here theoretical woman because it's theoretical. In the ideal situation, what would happen is you have a mom who is eats well and physically active before pregnancy. She gets pregnant. She gains the appropriate amount of weight according to her provider's recommendations. And this amount of weight, is by your pre-pregnancy body mass index. And then once she has baby, she's used the strategies that she had prior to getting pregnant, where she's eating healthy and she's physically active, and then she's back to her pre-pregnancy weight within about 3 to 6 months after the baby is born. And I say that's theoretical because that does happen, but it doesn't happen for most women. For most women, what we're left with is postpartum weight retention, which again is fairly self-explanatory, and there's not a hard and fast definition of the time frame at which we measure postpartum weight retention, but in the literature, it's usually how much weight you still have after pregnancy at about 6 months or 12 months postpartum. The literature tells us that if it hasn't come off by 6 months, chances are it's not coming off, which I personally found is a very upsetting statistic. I was really upset by that one. Weight retention is highly variable. So we'll see a range of maybe between 50 to 80% of women are holding on to about 3 to 10 pounds, which may not sound like that big a deal, 3 pounds, certainly not. But then we have a portion of women who have pretty high retention. So up to a quarter of women can retain over 10 pounds of pregnancy weight. And the number one predictor of that is excessive gestational weight gain. So those are the amount of weight gain that's outside of what's recommended given your pre-pregnancy body size. But we're talking about the postpartum issue right now, or the postpartum period. So you've already gained all that weight, and it's not possible to intervene anymore during the pregnancy period because we're in postpartum. And so again, we're left with this weight retention postpartum, and why does that really matter? What that does for a lot of women is move you from one category of body size into another. So maybe you started off within the normal healthy weight for your body or your height, and now you're in the overweight category. Or maybe you started off overweight and now you're in the obese category. And so for women who choose to have future pregnancies, that sets you up for a whole lot of maternal and fetal and child health risks. So things that we know happen for women is you have an increased risk for gestational diabetes, for interventions such as cesarean section and preeclampsia. But it's also linked, we're finding an association with childhood issues such as childhood overweight, some chronic conditions, and for women who start pregnancy obese, there's a higher risk of birth defects. But irrespective of having a subsequent pregnancy, women's health in and of itself is important. So we know that being overweight or obese, and again, this isn't news to anyone, I'm sure, but It increases your risk for type 2 diabetes, for heart disease, and for poor body image, among other things. And I wanted to just say a little bit about body image. This is not my specific area of expertise, but I can tell you that body image is how a woman feels about her body when you get pregnant. That your body changes, and often that is accompanied by a change in your body image. And that when we've talked to women across the board in terms, Hispanic women, they across the board report being unhappy with their bodies postpartum. So it's a very real issue. It's a complex issue, but we don't really understand what role it plays in terms of postpartum weight loss. But it's something important to keep in mind when we're thinking about what kind of interventions might we do in the postpartum period to help reduce the pregnancy weight. So the other reason why it's a really important issue is that women have said this is an important issue. If you ask them what's important to you in the postpartum period, they will say, losing that pregnancy weight, getting back in shape, being able to do things with my child, and it's difficult because I'm carrying an extra 30 pounds. And so they've also said that they're highly motivated to address weight issues. But unfortunately, we don't really have systems set up to help women do that. And as Allison mentioned, it's one of the things that aren't necessarily even covered in the postpartum visits, among all the other things that aren't covered in the postpartum visits. So it's certainly something that we need to do a lot better job on. So when I say emerging issues, I want to tell you some of the important things in the research now that honestly hasn't moved forward a whole lot in the last decade or so. One thing we know about postpartum weight loss and diet and physical activity in the postpartum period, and in pregnancy as well, is that provider advice is actually important. And I have 2 minutes left and a lot more to go through, so I'm going to go a little faster. So I will say that postpartum weight loss interventions are not very well studied. There's been a handful of randomized clinical trials. Some were successful, which is important because it tells us we can intervene and it could work. And they usually had diet and physical activity. Few of them brought in technology, and so that I see as an untapped resource. What they did find is that women lead incredibly busy lives. New moms are unbelievably busy and they don't have time to go to a group intervention, and so a lot of those weren't very successful. So we have to find a way to meet moms where they are. Social support was important, and even though we've had an explosion of apps and you can go on Weight Watchers and get chat and all kinds of things in that moment, we don't actually have any research about whether that's effective in helping women lose weight. So we want to think about what do we need to set up to help women in the postpartum period. It's a missed opportunity. You have this baby and then you're just sort of left to your own devices to do all these things that you need to take care of you. Provider advice is important, but it's not enough. And we don't know for those interventions that were successful, there's really no clear A plus B plus C equals success. They were all started at all different times. Some had home visits, some had phone counseling, but that didn't really work. They didn't really use technology. Do we intervene with moms for 6 weeks after birth, 6 months, a year? How do we actually get this into standard clinical practice? We don't know that. And most of the interventions that have been done in this area were done in the white population. So does this really work with other populations who might have different priorities or different needs? And we don't know the answer to that question. So what I'd like to leave you with is that pregnancy weight gain, postpartum weight retention are important contributors to overweight and obesity. And there's a whole lot that we don't know. And we need moms' input as the experts to really formulate effective interventions. So I am just thrilled to have postpartum moms here to be a part of this discussion. So thank you very much.